Welcome to this demonstration on the Bunnell test, a clinical assessment used to evaluate intrinsic muscle tightness in the hand. Today, we'll explore the differences between the intrinsic plus and intrinsic minus hand postures and understand how the Bunnell test helps in their assessment. Here, we observe the intrinsic minus hand, also known as the claw hand deformity. This posture is characterized by hyperextension at the MCP joints and flexion at the PIP and DIP joints. It commonly results from ulnar nerve palsy, leading to weakness or paralysis of the intrinsic hand muscles, specifically the lumbricals and interossei. The imbalance between the strong extrinsic muscles and the weakened intrinsic muscles causes this distinctive claw-like appearance. Now we see the intrinsic plus hand characterized by flexion at the MCP joints and extension at the PIP and DIP joints. This posture arises due to spasticity or contracture of the intrinsic muscles, often seen in conditions like rheumatoid arthritis or following neurological injuries. The overactivity or tightness of the lumbricals and interossei muscles leads to this position. Let's perform the Bunnell test to assess intrinsic muscle tightness. Hold the MCP joint in extension. While maintaining this position, attempt to passively flex the PIP joint. Now flex the MCP joint and again attempt to passively flex the PIP joint. Interpretation. The tip is to make it straight and avoid the confusion. This is the common position of the intrinsic plus hand, where the MCP joint is flexed. This makes the PIP joint more comfortable and mobile. So, if the PIP flexes more with MCP flexion, this is plus hand or tight intrinsics, flexion with flexion. This is plus, same with intrinsic minus hand with dominant extensor tendons. This is the common position of the intrinsic minus hand where the MCP joint is extended. This makes the PIP joint more comfortable and mobile. Same perspective, flexion with extension. This is minus hand. If PIP flexion remains limited regardless of MCP position, it suggests capsular or joint tightness rather than muscular. In summary, understanding the intrinsic plus and intrinsic minus hand postures, along with the application of the Bunnell test, is crucial in diagnosing and managing hand deformities. Recognizing these patterns aids in determining the underlying causes and guiding appropriate treatment strategies.